Hello guys, welcome back again. So we are discussing currently the 10th question. So a patient ill with diabetes felt acute pain in his right foot. Right? Objectively, foot thumb is black. For foot tissues are edematous. There are foci of epidermis, desquamation, stinking discharges. What clinicopathological form of necrosis is it? As you know, one of the most important complication of diabetes mellitus, obviously there are microvascular and macrovascular complications. Keeping them apart, one of the most common complication which you see is diabetic foot, right? So in fact I don't have diabetic foot picture over here, but just you look at this photo over here. So this is how the diabetic foot resembles in the leg, but this is in the hand region, right? So most commonly diabetic foot resembles the same thing in the leg region. So basically he's asking what type of gangrene. We know that this is gangrene, right? We call diabetic foot is also called as gangrenous foot. We know that it is called gangrene, but we have to morphologically classify what type of gangrene is it. So basically you have got three types of gangrene, right? Three types of gangrene. One is called as dry gangrene, another one is called as wet gangrene, and third one is called as gas gangrene, right? So there are three types of gangrene: dry, wet and gas gangrene. Now this picture which you are seeing here, this is the picture of dry gangrene, and this picture on the right, this is a picture of wet gangrene, right? Now in this picture of dry gangrene, you see the fingers, here very clearly. So this part till here the tissue is fine, but you see here it has become completely black, right? Now what is the reason for it? What is dry gangrene, what is wet? We'll be discussing it right now. But anyways, let me make a differential table. So when you come to dry gangrene, where do you see this dry gangrene most commonly? Most commonly this dry gangrene you see in the distal extremities. Distal extremities. What do I mean by distal extremities? Distal extremities in the sense the the distal foot or the distal upper limb, I mean the hands, the foot and all of these distal extremities, right? So there you see. And where do you see most commonly the wet gangrene? Most commonly wet gangrene you see in case of moist tissues. Moist tissues. Okay. Now when you look at the frequency, this wet gangrene, it develops very rapidly. Wet gangrene develops rapidly, whereas it takes time for dry gangrene to develop. Okay. And third important thing is macroscopically when you look, what can you see here? Macroscopically when you look, you can see this part here. Is it dry or wet? It is dry. Is it normal, or is it hydrated or properly, or it is shrunken? It is shrunken. It is which color? Dark black in color, right? It also looks like mummy fingers or mummy foot. I mean, if it happens in the legs, so mummy foot, right? So how does it basically look macroscopically? Macroscopically when you look, how does it look? It looks dry, right? And it looks shrunken. Not only that, it looks dark black, right? And also it looks like mummy fingers. Mummy fingers means not your mom or my mom, you know. In olden days there were mummies which are preserved there. When you look at those fingers, you'll come to know how does those fingers look like. Basically, as there is no tissue over there, I mean the tissue has completely become dried because of no blood, no water in the body, so obviously they look in this way. Okay, so Microscopically, we have so far discussed macroscopic, now we discuss microscopically. Microscopically, when you see, look here in this dry gangrene, did it spread away? Now what do I mean by that is, see here, there is a very clear border here between the dead tissue and the viable tissue. I mean between the living tissue and the dead tissue, there is a very clear border. Here also you see a very clear border. Here also you see a very clear border. So you have a clear line of separation. So what type of gangrene is characterized by very good clear line of separation? It is dry gangrene, right? Coming to the wet gangrene, macroscopically when you look, does it look dry or soft? It looks soft, right? Is it shrunken or swollen? It is swollen. So by looking it, you can see that once if you puncture, there might be a lot of putrid material in that, lot of rotten material, and moreover the color is dark. So overall, what are the words which we talked before? We told it is soft, right? And it is not dry, it is swollen. Adding about that, when you burst it, there is a lot of putrid material that is coming out, and rotten material, and also it is dark in color. These are the macroscopic changes. Now coming to the microscopic changes, now you tell me, do you find any line of separation here? Perfect line? No. See here. Okay, if you want me to tell this is the line of separation, is this clear or this line of separation is clear? The line of separation in the dry gangrene is clear. The line of separation in the wet gangrene is not clear. Then what happened to the thumb? You see in the thumb, slowly this part is developing gangrene here, right? Because it has turned red in color. You see this part and this part, compare both of this, the upper and the lower one. So there is no perfect line of separation, right? So there is no clear line of separation. So I can write it as no clear line of separation. Right? Now, for example, what is the most common cause of dry gangrene? The most common cause is loss of blood, or I can also call it as impaired blood flow. When you don't pass, or when you don't supply a proper amount of blood to your distal extremities, obviously they will undergo necrosis. They will undergo infarction and they will undergo necrosis and they will die. So impaired blood flow, right? I can also call it as ischemia. Clear? So what is the single most example here? The example of wet gangrene. The example of wet gangrene is diabetic foot. Diabetic foot is an example of wet gangrene. Clear? Now after this, as I already told you, there is another gangrene that is called as gaseous gangrene or gas gangrene. So let me show you. We don't have any picture. Yeah, let me show you the picture of gas gangrene. Yeah, you see this? This is the picture of gas gangrene. You see the bubbles over here. You see the bubbles, right? So these bubbles have heavy amount of gas within it. So when I tell gas gangrene, it means it might be caused by some bacteria, right? So this gas gangrene, obviously, moreover, this gas gangrene looks like a wet gangrene because there are no clear line of separation. You see, there are no clear lines of separation. So gas gangrene is a form of wet gangrene in affected area, accumulation of gas bubbles within the tissue. Okay, so this is the example for gas gangrene. But anyways, so this patient with diabetic foot, obviously what type of gangrene here? Diabetic foot, he'll be having moist gangrene.